Good afternoon. Thank you for joining us here today at the Pittsburgh, at the Bay Point Health Center, where we're going to be announcing our new initiative to curb preventable COVID deaths. So we have a nice group of people with us today who are going to speak about that topic. Let me tell you quickly who they are. We're also going to go through this in English, and then we have two Spanish speakers with us today who will give statements and then take your questions for Spanish speakers. So first we have, and I'll introduce them all, and then they will hand off one to the other. So we're going to start with Anna Roth, who is the County Health Director for Health Services. And then we will have Dr. Gabby Sullivan. Gabby is here. She's our Director of Ambulatory Care. And then we have Sharon Mackey. Sharon is the CEO of the Contra Costa Health Plan. Ori Zavelli. Ori is our Director of Public Health, and Gilbert Salinas. Gilbert is our Chief Equity Officer. So with that, I'm going to hand it over to Ms. Roth.
Thank you, and thank you so much for being here today, both in person as well as virtually. We're really excited to welcome everyone back to this clinic, the Bay Point Clinic, which really has been undergoing a lot of change, like all of us, in recent months. So we're really excited to open this clinic. We know that clinics here in the neighborhood are vital in terms of access. We know that having access to care can make all the difference, and we're going to talk a lot more about that today. Here in Contra Costa County, we've been a national leader in COVID-19 response. We know that out of the counties with more than 1 million people living in them, we have the second lowest death rate in the country. Now that's good news, but it's not good enough. We know there are still a lot of work to do, and I think the important thing that we want to share today is that today we really are at a different place. Like this clinic, we've undergone a lot of change, both as a health department, as a community, and as a nation. I think right now, I've been in healthcare for over 30 years, and I've never seen this level of transformation at this pace ever. And because of that, I think we're in a really good spot now. We have really, really great vaccines that are safe, free, and widely available at this point. We have tests. Just in the last few weeks, we've moved 50,000 tests into community clinics just like this and across organizations in neighborhoods all around Contra Costa County, specifically in those communities that have been hardest hit. We also have vaccinations. We also have treatments now. There are new treatments. There are treatments you can get to prevent getting COVID, particularly for those who are immunocompromised, as well as if you test positive for COVID, you can come and get treatments. So because of all of this new, I think, innovation that's happened in the COVID space, we feel confident that you no longer have to die from COVID-19. We believe that many deaths, in fact, most deaths, are preventable at this point because we have powerful, powerful tools available. So today, we are launching formally what we're calling the Contra Costa Path to Zero. Now that path includes, we're still doing the traditional step. We still want you to wear a mask. We actually, even though it's not mandated, here at the County Health Department, it's strongly recommended. And you'll notice everyone behind me is wearing a mask because it is strongly recommended. We also want you to stay home if you're sick. We want you to know where you can get your vaccines. Keep those vaccines up to date. There's a lot of changes that have gone on. Go to cchealth.org. You can go to the CDC, and there's a lot of information there about what it means to really be up to date on your vaccines. Now, if you test positive or if you're feeling unwell and you take a test either at your local provider or at home and you test positive, on Thursday, we opened the Contra Costa Health Plan advice line to anyone. It doesn't matter who your insurance provider is, your health insurance. It doesn't matter if you have insurance. You may call us, and you're going to hear from the Contra Costa Health Plan CEO in just a few minutes here. But let me tell you why this is so exciting to me. We opened this lineup on Thursday to everyone. And since Thursday, we've had 70 people get appointments through that line. and many have gotten prescriptions, some have not. But they've all gotten evaluated by a doctor, and they've been able to have that conversation. People from every health insurer in this region have called. So we feel very, very, I feel very grateful to our health plan for really taking the lead to make this life-saving medication available to all. So as we think about, we're going to hear a little bit more about what our health officer is going to talk to us about the death review. And the mortality review team, that we're going to be looking at every death in Contra Costa County from COVID to really start to learn more so we can have precision interventions. We can really start to figure out where are there missed opportunities? Where can we go farther? What are the kinds of tools that we really need to start employing at even a higher rate than we're doing now? And finally, we're going to talk about social inequities. Right? We're going to talk about equity because we know there are people in our community that we know that COVID, though it actually really it doesn't discriminate in terms of its spread. Actually, there's people that are being hit harder. There are people who are dying at higher rates, and far too often those are in our hardest hit communities that have been historically marginalized. And our Chief Equity Officer is going to talk with us about that in just a few minutes. But for now, I would love to hand it over now to our Medical Director of our Ambulatory Care and Specialty Care, Dr. Gabriella Sullivan. Thank you.
Thanks, Anna. Well, bienvenidos. Welcome to the reopening of primary care here at this location at Bay Point. For the last 2 years, Bay Point has responded to the public health emergency and has pretty exclusively focused on COVID vaccination and testing. And in fact, many of the citizens of Contra Costa County and beyond received their first vaccine ever here at this site. So it's been quite at the epicenter. But instead of focusing just on COVID care, we are now reopening all primary care services here, and that is really exciting to us because it signals a new stage of care for COVID and everything else. So we're going to be back to doing well child visits, immunizations, teen physicals, cancer screening, diabetes, and blood pressure care, and everything in between. So we're really, really excited about that. I want to say that I believe Bay Point has missed us being here for them, and we have really missed being here for our patients. So it's very exciting for us to come back. And the two providers that will be working here have been working here for years. The community knows them very, very well, and they've had patients here for years and years. So it's just wonderful to be back here. I just want to talk for a moment as well about COVID outpatient treatment. And as Anna was talking about, there is a brand new medication. Well, it's a few months old. It's FDA approved under emergency authorization. It's called Paxlovid, and it's extremely effective outpatient treatment for COVID. There are some things that have to be reviewed in order to get that prescribed. That's why it does need to have a prescription from a medical provider. But it's extremely, extremely effective. And the reason this is so important and kind of segues into outpatient care is that it signals a transformation of care about COVID from an acute environment to an outpatient environment. And that is really great news. So if anyone tests positive for COVID, you can be evaluated and see if you can get this medication. And Sharon Mackey from the health plan will talk about how to access that helpline and those resources. And I also just wanted to show you these at-home test kits that we're doing. So all of this is at-home testing, at-home treatment. And we are providing these free to our patients, and many places are also providing these free to patients, and they're very accessible and widely available these days. So welcome, and thank you so much for being here. And I'm going to pass it off to Sharon, the CEO of the health plan.
Thank you, Dr. Sullivan. Good afternoon, everyone. And as Anna mentioned, our health plan, Contra Costa Health Plan, it covers more than 215 lives here in the county. And now we're so supportive and super happy about the path to zero. And this is where, as Anna mentioned, we open up our advice nurses line, which is 24/7. And that line is open to everyone in the county, all 1.1 million residents. And it doesn't matter what insurance that the member may have. Also, we want to make people aware of the public as to things that we've been doing in the past. Recently, we began to send out text messages so that any county resident that got a positive COVID test, we have encouraged them that they can call our advice nurse line. And that number is 877-661-6230. And as I mentioned, it is available to all county residents, regardless of what insurance plan that they have. So what our advice nurses do 24/7, they will help schedule a telehealth appointment with a physician. And they can, what the physician does, as Dr. Sullivan mentioned, they can evaluate the person and also recommend treatment and also a prescription. So we're super excited about this. And also we are aware that many people are doing the COVID testing at home. So that doesn't matter, that's okay as long as they get the test. So anyone who tests positive for COVID, they can also call our advice nurse line. Now I'll repeat that number again. So that's 877-661-6230. So thank you, and at this point I'd like to turn it over to our public health officer.
Thank you, Sharon. So we've learned a lot about COVID in the last few months. We've learned a lot about how to prevent it through masking, through testing, and now through early treatment. And just as a reminder, the treatment is free to anyone, regardless of insurance, by calling the Contra Costa Health Plan Advice Nurse Unit. Another thing that we're doing as part of the Path to Zero is something we're calling mortality review. This is an important part of understanding who is dying from COVID and why. We need to define what a preventable death is, and to do that we ask a lot of important questions. So we look at their medical record if they've passed away, and we ask, were they able to be tested in a timely manner? Did they seek out treatment, and were they able to get treatment in a timely manner? Did they have an opportunity to get a vaccination, and were they boosted? Were they able to access their care in a timely manner? Were they hospitalized, and where, and so forth? And if the answer to any of those questions is no, we may find a gap in care. It shows us what we did well and also where we fell short. And understanding that is key to improving our services, making sure that we reach even more patients and reduce the health disparities, reduce the number of people who are passing away from COVID. With that, I'd like to introduce our Chief Equity Officer, Gilbert Salinas.
Thank you, Dr. Zavelli. Since the beginning of the pandemic, we have been focused on communities that have been hardest hit by COVID-19. Contra Costa Health has emphasized equitable distribution of the vaccine since it became available in December of 2020. Between March 2021 and March 2022, we provided more than 160 mobile vaccine equity clinics. In that same period, our outreach teams has engaged over 1,800 people within our county to receive the vaccine. These efforts significantly closed the equity gap in vaccination between African Americans and our white populations. It eliminated the gap, the equity gap that existed before between Latinx and white populations. But with the arrival of the booster, the disparity is back. Only 38% of our Latinx population has received a booster. and only 39% of our African American population has received a booster, compared to 52% of our white population. African Americans and Latinx residents have experienced the highest death rates from COVID in our county. Since July of 2021, Latinx residents have died twice the rate of white residents, and African Americans have died nearly 3 times the rate. Using the state's Healthy Places Index, we know that COVID death rates in most healthy census tracts are more than 5 times lower than the rates of our less healthy tracts. These are cities like Richmond, Antioch, Pittsburgh, and Oakley. More people in all age groups died in our less healthy census tracts than people over the age of 65 in our more healthy communities. So in other words, you are more likely to die in a less healthy community, regardless of your age, than you are to die if you were living in a healthier community, as listed by the Healthy Places Index. So here's what we're doing. Between now and the end of June, we will host 56 equity mobile vaccine clinics. The clinics will serve less healthy communities. We will have a targeted approach for these clinics. And we don't just administer vaccines, we will also distribute testing kits and hand out valuable information on where to go and what to do if you test positive with an at-home test kit. In addition, we're hosting 4 at-home test distribution events in the coming days and weeks in areas that have been hardest hit by COVID. Anyone can come get 2 free test kits. That's any person can come and get 2 free test kits at the following locations. On May 5th, you can show up at the Contra Costa County Block Party in Antioch. On May 10th, you can go to Cielo Market in Antioch. On May 14th, you can go to St. Anthony's Church in Oakley. And on May 19th, we will be at the Old Town Pittsburgh car show. And you can come receive your test kits and a vaccine. Any business or community organization that wants to host a vaccine or receive test kits can sign up, fill out a form on our website and receive these test kits. And in closing, we all need to continue this very important work to address and eliminate the unnecessary burden of death that African Americans and our Latinx community face in Contra Costa County. I will now hand it over to Supervisor Federal Glover.
Thank you, Gilbert. And let me just say that it is an exciting day that this hub is reopened to do all the work that we need for our constituency here within the Bay Point community. But it is also an opportunity for us to share the great work that our county staff has done down through the last couple of years in providing vaccines, the testing, and all those things that are so necessary that have saved lives within this county. We have been a leader in that respect. But we have much more work to do. As Gilbert has shared with you, there's a lot more work to be done to close the equity gap between the Hispanic and African American community. We want to let you know today that we will remain a hub that will be looking at doing more vaccines here and more testing here. So it will continue. The pandemic has become something that we will have to learn to live with. It is not going away anytime soon. So let's take the proper precautions and make sure that we continue to save lives by people actively, our community at large, actively staying involved and taking the precautions that you need, wearing your mask, getting tests, getting the vaccine. This is what it's going to take to continue to save lives. We must encourage those communities, the Latinx and African American community, to get the vaccines, to continue to be tested. The tests are free. The at-home tests are free. And anyone who would like one is open to it. not just those that are a part of the county's program. So once again, we're happy to be here today, happy to reopen for all services that takes place at this hub, this clinic here in Bay Point. So thank you for listening in today, and let's continue to save lives.
Thank you, Supervisor Gilbert. So we'll take questions in English and then we'll do some Spanish statements. Is the sound okay? I just want to check on sound. Okay. All right. Any questions for any of our English speaking? Who would you like to?
Yeah, well, I actually have a question for Mr. Salinas. When you talked about the higher rates of COVID among Latinx and African Americans, are there any specific theories as to why that is? Is the vaccination rate lower? Are there fewer test kits? I mean, what seem to be the theories of why that's the case?
Very early on during the vaccine distribution, we noticed through our data that we were seeing huge gaps in terms of vaccine getting out into communities of color and historically marginalized communities. What we know is that historically, not just because of COVID, but our communities have suffered because of lack of access to healthcare, housing issues. A lot of our historically marginalized communities have essential jobs, and they cannot stay home and telework. They must come to work. And in some cultures have intergenerational. There's generations of people in one household. So all of these factors contribute to the reasons why we have high rates of mortality.
Excellent, thank you so much. And then I just also wanted to have a question about the antivirals. First of all, having a relative that has COVID, it's very hard to get those at the pharmacy. I went to 5 pharmacies to get it. So how hard is it to get these antivirals? And can someone address the fact that people need to get them right away, right after they could test positive, the need to do it quickly, and how you're handling that?
Let me start with that, and then I'll call in one of our physicians. So first of all, we have been here. One of the reasons that we actually opened that CCHP, the Contra Costa Health Plan advice line, is because we were hearing the same thing. People were saying, we don't know how to get the antivirals. We tested positive. We've called. We got kind of a vague direction, and that's not just here in Contra Costa County. That's actually been sort of nationally. That's been what we've been hearing. So that is exactly what we're trying to do, is make it easier. We're trying to unlock that doorway into getting early access to care. It is true, it needs to be timely. You do need to get those medications in, began within 5 days of symptoms. And I'll actually have one of our physicians, I think our health officer, Dr. Savelli, can talk a little bit about that. But yes, you can call CCHP's advice line, and there is actually doctors available to talk to you now. And it doesn't matter if you don't have if you don't have our health plan. It doesn't matter if you didn't get vaccinated. You know, we're here to try to really increase access to those antivirals, because we do absolutely know that it's vital people start those within 5 days.
But can you just clarify, does the county have its own stash of these antivirals, or are people left to go to their pharmacy? You know,
Both.
Thank you for that question. So yes, not every pharmacy has the anti-COVID medication, but when you call the Contra Costa Health Plan Advice Nurse line, they will have a list of which pharmacies do. So they will ask the patient, where do you live? What's the most convenient place to you? And they'll give you an option of places that have it. We are constantly updating that, and as time goes on, more and more pharmacies will have the supply. But there's still too many barriers. So I just want to emphasize, you can call our advice nurse unit to get treatment. Doesn't matter your insurance or whether or not you have insurance. If you have Medi-Cal or Kaiser or private insurance, we'll accept patients regardless of their insurance. And we want you to call as soon as possible after your diagnosis, because the treatment is most effective the sooner you take it. If you call us and say, I took a home test and I was positive, we will believe you. We will not make you do another test. We will believe you, and one of our doctors will review your medications with you, make sure that you qualify, make sure that the medicine is safe for you. We'll look up where the medicine is available, and we'll get the prescription to that pharmacy.
Excellent.
All right.
I'm just gonna.
Yeah, go right ahead. Go
I
right
need
ahead.
to hog the show here. But can you just clarify whether this 24/7 line that you have Spanish speakers and people speaking in other languages as well?
Yes, we do. It's a multilingual staff. And we also have a translation line also available.
Great. Thank you.
Okay.
Thanks very much.
All right. Dr. Sullivan, would you like to start with a Spanish, and then Gilbert, if you'll maybe follow her with a couple Spanish remarks?
Sure. I'll just do an abbreviated version of what I did. Okay. So, really now, bienvenidos. Estamos aquí para celebrar el abrimiento de este sitio para cuidado de prevención y cuidado normal que se hace en todas las clínicas, ¿no? Entonces, porque por los últimos 2 años hemos estado en la emergencia de salud pública y este sitio se ha usado principalmente para hacer pruebas y vacunas de COVID. Pero empezando ahora esta semana ya vamos a abrir a todo el cuidado que siempre hemos hecho en esta clínica antes de los últimos 2 años, es decir, prevención, citas para los niños, para las mujeres embarazadas, para diabetes, para la presión, no importa qué tipo de condición médica, aquí vamos a ver nuestros pacientes. Sin embargo, vamos a continuar en la lucha del COVID y lo más importante en este momento es de saber que hay un tratamiento muy eficaz que se llama Paxlovid, que es un tratamiento antiviral, es para casi cualquier tipo de persona, bueno, no para los niños chicos, pero lo que tenemos es que tenemos unos doctores listos para contestar llamadas telefónicas ya le vamos a decir, o ustedes van a decir el número que se puede llamar para comunicarse con una enfermera, que luego puede comunicarse con un doctor y pueden revisar si este medicamento es adecuado para uno. Se tiene que empezar dentro de los primeros 5 días de infección, por eso el tiempo es muy, muy importante. Pero lo fantástico es que ahora estamos haciendo una transición de tratamiento no en el hospital, sino tratamiento en la casa. Y también, por supuesto, tenemos estas pruebas que se pueden hacer en la casa, tenemos las pruebas y tenemos el tratamiento, las dos cosas, todo que se puede hacer en la casa. Y aquí estamos para apoyar a nuestra comunidad y para darles el bienvenido de volver aquí a la clínica a ver a sus doctores, y aquí vamos a estar para la gente de Bay Point y para todas las personas de Contra Costa. Muchas gracias.
Gracias, doctor.
Nosotros sabemos que la gente que ha muerto más por COVID-19 son las personas que viven en nuestras comunidades afroamericanas y latinas. Tenemos que enfocarnos y estar centrados en estas comunidades y traer todo el esfuerzo que tenemos, todo lo que tenemos de equipaje, de poder y de socios con nuestras comunidades para trabajar duro, para batallar a COVID-19. Mucha gente cree que COVID-19 ya se ha muerto, se ha desaparecido, porque no la ven en las noticias, no hablan mucho de ella, pero todavía existe. Hay mucha COVID-19 en nuestras comunidades, así que tenemos que protegernos a nosotros mismos, a cada uno, a la abuela, a la tía, a tu mamá, a tu papá, a tus hijos. Hay que protegernos contra la COVID-19. Ayúdenos en la lucha contra COVID.
Gracias.